Good morning. A very warm welcome to this Ageism Awareness Day webinar brought to you by Healthy Ageing Partnerships, commonly known as HAP. HAP is a network of collaborative partnerships that promotes healthy ageing initiatives across the Sunshine Coast. My name is Colin Maddocks. I'm the Secretary of HAP. I'm delighted to be the host for this webinar on behalf of HAP. The webinar is one of several HAP events this October Seniors Month. Our theme for the month is Sunshine Coast towards becoming the most age-friendly region in Australia. We begin by acknowledging the traditional owners and custodians of the land and waters from where this webinar comes to you from, the Gubbi Gubbi and Jinnaburra people, and we pay our respects to their elders past and present. Our warmest thanks to Coast Queensland, who is kindly hosting this webinar. The webinar will run for a maximum 1 hour, and we have 3 outstanding speakers from major HAP partner organisations, EveryAGE Counts and the University of the Sunshine Coast. After the presentations, there will be a short Q&A session. If you have any questions, could you please type your question in the sidebar comments on your Teams screen? And this can be done anytime during the presentation. We will then assemble the questions and respond to as many questions as we can during the last part of the webinar. Please note that we have silenced microphones so speakers are not disturbed during their presentation. We are recording the webinar so that it can be available to people who could not join the webinar today. Now, our first speaker is Dr. Marlene Krasovitsky. Marlene is a leading advocate for age equality and the founding director of EveryAGE Counts, Australia's coalition-led campaign to end ageism. Marlene is a former consultant to the World Health Organisation's global campaign to combat ageism and has consulted with HelpAge International to map ageism initiatives globally. I have worked alongside Marlene for the past 3 years, and she is an incredibly hard-working volunteer who passionately advocates for our age group. I am personally thrilled that she could join us today. Marlene will define ageism and answer the question, why Ageism Awareness Day? I introduce Dr. Marlene Krasovitsky. Thank you, Marlene.
Thank you so much for that lovely warm introduction, and hello everyone. May I also begin by acknowledging that I'm on the Gadigal lands of the Eora Nation and pay my respects to elders past, present and emerging. And may I also extend my respect to Aboriginal and Torres Strait Islander people with us today. So today is Ageism Awareness Day, and I'm going to focus my presentation on answering the question, why does Australia need Ageism Awareness Day? So as Colin said, let's start with the definition of ageism. There are 3 elements that we need to be thinking about when we think about ageism. Ageism is stereotyping, prejudice, and discrimination towards others or oneself based solely on age. It's how we think, the stereotypes of older people as frail, foolish, forgetful. How we feel, our prejudices that old is bad, ugly, scary, and how we act. Discrimination, locking people out of work or overlooking them for promotions or training because of assumptions that they're just on a path to retirement anyway. Ageism, like other forms of prejudices, biases and discrimination, is based on othering. If they're not like you, well, this opens up all sorts of ways to think about them and treat them differently. But here's the thing, this is actually not about the other. This is about us. They are us. If not now, then soon. We're all aging and we are all capable of being ageist. Now, ageism can be experienced at any age, but ageism against older people comes from these deeply negative feelings about what it means to get and to be older. Ageism is pervasive, accepted, and normalised. It's underpinned by powerful stereotypes and unquestioned assumptions, which lead to exclusion, marginalisation, and inequity. Now, ageism can be benevolent talking to me as if I'm a child, not recognizing my agency or autonomy or being overly protective, or malevolent, abuse, neglect, mistreatment. Both are harmful, and I look forward to hearing much more on this from Professor Traynor. Ageism is all around us in big structural ways like discrimination in the workforce, elder abuse, and in everyday ways like ageist jokes, ageist birthday cards, making older people feel invisible, ignoring or deriding older people, and the way older people are stereotyped in media and advertising. So why do we need Ageism Awareness Day? I'm going to answer that question with another question. How do you feel about getting older? That's the question we put to thousands of Australians when we began EveryAGE Counts, which, as Colin said, is Australia's national coalition and grassroots campaign to end ageism. What do you think we heard in response? Fear, dread, associations with decline, dependence, dementia, and death. In short, getting older is seen as a negative time of life, certainly not one to look forward to. We deny getting old, being old, we hide our age, and so on. And it's those negative views, assumptions, and expectations that lies at the heart of ageism. And we've all internalised a bunch of those negative beliefs and fears about getting older. We don't question them, but they do have an impact on our decisions, our expectations, how we treat others, the language we use, and how we ourselves age. But if we can challenge those assumptions, bring them to light, we can consciously and deliberately undo this limiting and devastating form of prejudice and discrimination. All of the megatrends and data tell us that generally we are living longer, healthier lives. We are adding years to life, but are we adding life to years? Ageism is a barrier to aging well, and these barriers live in our heads, our relationships, and our institutions. I'm going to give you some examples. Our heads. As I said, we've all internalised a bunch of these fears and misgivings about getting older. And it's not surprising, as so many times we're cast as a burden, irrelevant, just in the way. How many times have I heard, I hate getting old? And it comes in many shapes and sizes. I'm too old to, it's too late for me to, I guess this pain is just part of getting older, I've had my turn, I'm embarrassed by my older body, I hate it, and so on. And most of us just nod in agreement and accept, well, yes, that's the way it is. It's all downhill from here. And for some, it may be. I'm not trying to rose-colour anyone's reality here. Ageism is also in our relationships, and you've all seen it. Ignoring me, speaking past me, thinking I've got nothing relevant to say, not recognising my autonomy, my rights, all the way to being abused and neglected. Ageism can mean I don't have the confidence or the voice or the means to participate. I may not feel welcomed or included or that I belong. Others' attitudes can make me feel unattractive, slow, incompetent, or that I've got nothing to contribute. These are very powerful barriers. Ageism feeds the depersonalising and devaluing of older people and our rights. We stop being heard, our complaints are trivialised, our health concerns are dismissed, and our autonomy and agency can be whittled away. Now, at the institutional level, ageism is baked into our workplaces, our healthcare, and so many other institutions. For instance, we know that ageism locks older people out of work, that in some places it makes it okay to triage older people on the basis of chronological age alone in the health system. We saw this during COVID, or to stop preventive health screening at certain ages. It's also why clinical trials and research exclude or clump together older people, even for conditions that are more prevalent in older age. And ageism is what makes it okay to see older people as one homogenous cohort, to label us, to treat us and see us all in the same way, and deny the splendid diversity of older people. And of course, because none of us lives life in one dimension, ageism intersects with other forms of discrimination like sexism, racism, homophobia. An older woman's experience will be very different to an older man or an older woman from a different cultural background. We are not one homogenous clump, so treating us as the same is absurd. Now, much of the ageism that happens is not explicit. You don't formally restrict people over 55 from applying for your job because it's against the law. You just don't consider hiring one. You don't ban older people from your shop. You just ignore them when they come in. And it's somehow still okay to tell ageist jokes, deem older people's views as irrelevant, treat older people as children and assume away their decision-making capacity and not take their health concerns seriously, because after all, it's just part of getting older. So back to our question, why do we need Ageism Awareness Day? Well, let's look at some of the impacts of ageism. According to the World Health Organization, 1 in 2 people hold ageist views, and 1 in 3 people across all age groups report experiencing ageism. And this includes being insulted, abused, excluded, or denied services because of their age. In Australia, research consistently tells us that people experience ageism. It has negative impacts. It keeps people out of work, marginalises people, makes older people feel invisible, diminishes their value and erodes their rights. And it's most often keenly experienced for the first time in the workplace or trying to get into work, followed closely by healthcare. With regard to workplaces, we know that nearly 1/3 of people over 50 report experiencing ageism in the workplace. And even though many organisations today are experiencing recruitment difficulties, we know that many hirers actively exclude older workers from the recruitment process. This active exclusion is, of course, then reflected in the high numbers of people over 45 receiving unemployment benefits. And once older workers lose their job, they're much more likely to end up being unemployed for the long term, running down savings, losing confidence and skills, becoming increasingly marginalised. We must acknowledge and address the hard barrier to employment that is ageism. And we also know that ageism has negative impacts on health and well-being. The WHO found that if we experience ageism and internalise all those negative beliefs about getting and being old, it shaves 7.5 years off our life. Ageism leads to poorer health, social isolation and loneliness, reduces quality of life as people become disrespected and devalued. And it also affects how we feel about ourselves as we get older, because many of us have internalised the rhetoric of older people being a burden, rather than focusing on the many benefits and opportunities that flow from living and working longer. No one wants to be thought of as a burden, and framing older people in this way creates the conditions for the callousness, neglect, and abuse that we have seen. It feeds the depersonalising and diminishing of older people and their rights. And so we have a problem, and it's ageism. It's not ageing, it's ageism. And that's why we need Ageism Awareness Day. And that's where EveryAGE Counts comes in. We are a national coalition of organisations, including community-based advocacy, research and service organisations and local councils, and many thousands of individuals who are working together to build an Australia without ageism. And these issues cross party lines, and EveryAGE Counts has received support from all sides of politics, because these issues are above politics. These issues are about all of us. Which brings me to how and where we live. And I quickly want to draw the connection between ageism and age-friendly cities and communities, not for too long, because I know Professor Neville will tell us much more. But we do know that age-friendly cities and communities are essential for ensuring that older people can continue leading fulfilling, active lives. An age-friendly environment recognises that older people have the same desire to remain physically, intellectually and socially engaged. When I think about age-friendly cities and communities, I imagine a backbone, a skeleton, creating the conditions for us all to age well. It's the scaffolding upon which to build participation, enhance quality of life, uphold rights, to enable current and future generations to age well. And I know that addressing ageism is at the heart of the age-friendly movement. For example, in Australia, there are many local councils engaged who are engaged with the age-friendly movement, have joined EveryAGE Counts as a primary prevention strategy to shift negative attitudes and social norms about older people in order to prevent elder abuse or to promote healthy ageing. And we are seeing global, national and local campaigns to combat ageism, which are challenging the invisibility and widespread acceptance of ageism, bringing it out of the shadows and recognising its impacts. The age-friendly movement is about the rights of older people to live in and participate in their communities. Combating ageism is also about the rights of older people to live in and participate in their communities, and that is in all our interests. So in closing, EveryAGE Counts aims to build an Australia without ageism, where we see positive policies, programs and narratives around age inclusion, valuing intergenerational links and the rights of older people and the intrinsic value of life at all ages. In short, an Australia that respects everyone and everyone's future self. I invite you to go to the EveryAGE Counts website, everyagecounts.org.au, and take the pledge to end ageism. Have a browse through our resources and be a part of this social movement. We warmly welcome you. Thank you.
Marlene, thank you for a very, very stimulating address. And for the link that you have now provided there for Professor Neville, and that is the link to an age-friendly community. Professor Stephen Neville, his research focuses on ensuring communities promote healthy ageing and are appropriate places for older citizens to age in. He is an executive member of the University of the Sunshine Coast Healthy Ageing Cluster, where he leads a program on research, a program of research on age-friendly communities. His latest research included the development of a protocol for government and councils to utilise when assessing the age-friendliness of their communities. This work influences policy, practice and education and resources for communities to support their accreditation by the World Health Organization as an age-friendly community. In my community addresses as the local EveryAGE Counts advocate on the Sunshine Coast, I often include ageism through an age-friendly community lens because I understand in a more age-friendly community, older people can thrive. I'm really now looking forward to Professor Neville's address where he will outline the research he's involved with and how age-friendliness in community can be measured. I welcome Professor Stephen Neville to address us.
Thank you,
Stephen.
Thank you very much for the introduction. Just to preface my presentation on the previous work that I've undertaken, as I'm a recent arrival to Australia from New Zealand. So the work that I'm presenting today is the age-friendly work that I've undertaken for central and local governments within a New Zealand context, which I think will resonate with you here in Queensland. So can I have the next slide, please? Okay, so this slide is just outlining the demography around our ageing populations up until 2050. And you'll see that Australia sits mainly within that 10 to 30% of people who will be older by 2050. Next slide, please. So again, why age-friendly? And Marlene did touch on some of these issues, but for age-friendliness has come about because it is a response to older people living longer. It does support ageing in place and active ageing. So making sure that older people can live in communities that they are familiar with and actually want to age in. We do know the evidence from all of my work clearly links having a community that's age-friendly with physical health and well-being. And we also know that older people prefer to live in communities that they are familiar with. And as a consequence of that, it reduces admissions to long-term care. Can I have the next slide, please? Okay, so here is a quick overview of the WHO 8 domains of age friendliness. And you will actually see the synergy there between that and ageism. So if you have an age-friendly community, it will certainly reduce ageism as experienced by older people. So the 8 domains relate to things like transportation, having appropriate housing for older people, ensuring that there are opportunities for social participation within communities, that older adults are respected and socially included within their communities, and that they have opportunities for civic participation and also to be employed, no matter what their age. The domains also highlight things like making sure that we have appropriate community support and health services that are accessible, that our outdoor spaces and buildings are also accessible to older adults as they go about their days, and that the way that we communicate with older people about our communities is appropriate. Okay, next slide, thank you. So the WHO have a global network of countries and cities and communities, and as you can see that in Australia is represented. So Queensland is part of the WHO global network, and also New Zealand, where I was born, is also significantly involved. Next slide, thanks. Okay, so here's just a brief summary of some of the previous age-friendly work that I've done for central and local governments in New Zealand. So it's been quite widespread. I will touch on age-friendly Napier when I present in the next few slides around the tool that we utilised. But I suppose I just want to say at this point that the outcome of the research that we've undertaken in New Zealand has been significant. And it hasn't cost a lot. It hasn't cost councils a lot to implement, to make quite significant changes. So a classic example is we did a project looking at people aged 85 years and over that live in the inner city of Auckland, and Auckland's our largest city with 2 million people. And there's a significant number of older people that actually live right downtown. So our research identified that key meeting places for this group of people was at bus stops. And so we lobbied the council to make sure that every bus stop had appropriate seating for for people generally, and also that it had shelter, because I don't know if you know Auckland, but it does rain quite a lot there. So again, really simple, fundamental changes to a community that has quite significant and positive effects on older people. Thank you. Next slide, please. Great. So I'll just move on to the Age-Friendly Cities and Communities questionnaire, which has been developed. So you can see on the right-hand side, that's a copy of the questionnaire that communities can use to assess whether how age-friendly they are. But it is a validated tool, and it was developed to assess how age-friendly communities are. It was originally developed in the Netherlands, but it has since been used quite widely across the world, including in Australia, in Adelaide, in Adelaide City and the outer Adelaide kind of city region, as well as in New Zealand. So the question covers 9 domains. Now, in the previous slide, the WHO domains, we identify 8. But as part of using this questionnaire, we've added financial well-being as another domain, because we know through our research that finances is one of the strongest predictors of older people identifying that their communities are age-friendly. The questionnaire has been recognised by the WHO, and they're promoting it to be used globally so that they have this a global data source that they can draw on around developing policies related to older people. And the tool actually identifies community strengths and weaknesses to do things like improve infrastructure and services that are provided for older people. Okay, thank you. Next slide. So I'm just going to move on and give you a brief overview of how we validated it for use in New Zealand. So we utilised a small provincial city of approximately 20,000 people called Napier. And we started by putting together a panel of experts, so 5 age-friendly experts and 5 older people who are experts in being older, to have a look at the questionnaire and make sure that it was fit for purpose and clearly understandable for Napier. And only minor changes were made. So, for example, there was terminology around the use of trams. Well, Napier has buses and no trams or trains. So we just made some minor changes, and then we sent it out to validate it to the older communities within Napier City. And as a result of that, the questionnaire is now validated for use across New Zealand. Next slide, please. Great. And so in order to validate the questionnaire, we needed 200 older people to complete the questionnaire. And in order to have a representative sample, we needed approximately 385 people. And we actually ended up with 354 completed. We had over 400 surveys returned, but 354 were eligible and fully completed. And so we used that for our data analysis. So next slide, thank you. Great. So here's the key findings from the questionnaire. So you'll see that we've identified 5 clusters, and I will go into greater depth around those clusters over the next few slides. But the dark green indicates happiness and support in terms of saying that those domains are age-friendly within particular clusters, and the kind of dark, it looks pink to me, shading under transportation indicates where in a cluster people identified that transportation, for example, was a really major issue for them. So that the different shading just indicates the different scores that we then analysed and put into these clusters. So I'll just quickly go over each of the 5 clusters. So next slide, thanks. So and we named each of the clusters, and that was according to the findings. So the first cluster we termed those older people who were disenchanted. So we knew that in that group, from the findings, that 41% were men, and that was the highest proportion of men across each of the clusters, mainly European, which is not a surprise in that particular area. Quite highly educated in terms of having tertiary qualifications. Some were still working. And then we identified things like that they were the highest number of group of people who lived alone, had the most health issues, and were in more need of assistance, and were the highest users of mobility aids, and scored the lowest in terms of self-rated quality of life. So in the next slide, please. Yep. So we called cluster 2 those groups of older people who were struggling. 69% were women in this cluster, not overall, but in this cluster. It was the second highest percentage of people who were in their 60s and 70s. Again, mainly European. There was a larger number of people identifying as Māori, which is the Indigenous peoples of New Zealand. Again, quite well educated. The majority of them were actually renting and actually didn't own their own home. quite a number of them drove a car, and that's not surprising because Napier, being quite small, doesn't have good public transport, and being able to access the local hospital is 20 kilometres away. So that is a main issue for both clusters 1 and 2. Next slide, thanks. Okay, clusters 3 we've identified as those people who are managing. Highest percentage of women here, 66% within the cluster had health issues, but they were the 3rd highest who rated themselves in terms of having quite good quality of life. Next cluster, next slide, sorry. Slide 4, we identified these people as being happy and healthy. So again, a lower proportion of Indigenous New Zealand, Indigenous Māori peoples. They were the least educated in terms of qualifications. Most weren't working, and 40% of them lived alone, but they were the healthiest group out of each of the 6 clusters. Okay, next slide. And this is the last cluster, cluster 5, where life is good. I really like this. The highest percentage across all of the clusters were aged over 80. And that says something about that, that group. And most of these people actually own their own home. And they also had the highest percentage of people who were still driving and held a license, and they identified that they had very high self-rated quality of life. Okay, next slide. So what we did with the findings from this is that we launched it for the Office for Seniors and to the Minister for Seniors in New Zealand in August of 2024. And what we did is we produced a guide to being able to assess communities across New Zealand to see if they were age-friendly or not. And interestingly enough, so far 10 councils across the country have picked it up and have started the assessment of their communities. So they've actually begun on the age-friendly journey, which we're really proud of. So some of the key policy influences, oh, that disappeared.
Click once.
Yeah. So from the research that I've undertaken in New Zealand, there have been some quite significant policy influences. So it's certainly influenced social policy around lobbying councils and promoting age-friendly initiatives at local and central government levels. The research across a number of different locale, it's very place-based, and it's for us it's highlighted in New Zealand the specific needs of rural older adults. And Marlene talked about that older adults aren't homogenous groups of people. Well, that also goes into where older people live. You know, you can't just homogenize age friendliness from remote, very remote, rural into peri-urban and then metropolitan environments. They're very different environments. So we've expanded in New Zealand as a result of the research that has been undertaken into diverse population groups like Pacific Island groups, our Indigenous Māori within the country, as well as into rural areas. And there's been a really strong at central government level on reducing ageism. So next slide. I've got 2 slides to go, so I'll be on time. So some age-friendly pointers from the work that I've undertaken is it's really important for the success of age-friendliness to make sure that there is a top-down and a bottom-up approach. And what that means is that there is support from central and local governments, as well as support from and buy-in from communities. So that's from older people actually living in the communities of which any age-friendly initiatives are going to occur. And it's these community people that should be determining the focus of what councils should be focusing on. it's also really important that local governments have dedicated steering groups for older people that have diverse representation, to make sure that we aren't that we have a focus on the heterogeneity of older populations, and to make sure that you build on strengths of communities and identify realistic projects that will succeed. Next slide. So where to from here? I'm about to embark on a project to validate the age-friendly cities and communities questionnaire in Queensland and rural, remote and very remote areas. And that'll be quite unique. The WHO are very interested in this work because they don't have any data on it. So that's me. So thank you very much.
Thank you, Professor Neville. I'm looking forward to perhaps sometime in the future when those tools may be used here on the Sunshine Coast for some research into that might inform us about the needs of older people on the Sunshine Coast. Thank you, Professor Neville. Our next speaker is Professor Victoria Traynor. Professor Traynor has over 30 years of experience as a registered nurse specialising in gerontology. Professor Traynor was at the University of Wollongong for 18 years, where she was Professor of Aged and Rehabilitation and has held a range of academic roles. Professor Traynor commenced her role at the University of Sunshine Coast in 2024 as the Director of the Healthy Ageing Research Cluster in the same year. Professor Traynor was appointed as the inaugural Professor of Dementia Research at Warragul in New South Wales too. We are super thrilled that we can boast that we have our very own Professor of Healthy Ageing on the Sunshine Coast. I have the pleasure of working closely with Professor Traynor in my HAT and other volunteer roles. Like Marlene and Stephen, Vicky is a very passionate advocate for the needs of our cohort. I welcome Professor Traynor to provide an address about benevolent ageism, particularly as it relates to nursing homes. Professor Traynor.
So I have an acknowledgement of country as well. So for those of you who, could you share with us where you're joining us from? Colin's already done the acknowledgement of country, but I have this beautiful painting from a Wiradjuri woman, and she created it for us for the research that we do. And it focuses on emphasising the ripple effect that we can all have. So we don't just have an impact on the people we're interacting with in our close environment, but wherever we have a positive attitude towards older people, that can be rippling beyond where we can actually see the effect. So please join us in sharing where you're joining us from today. And I did want to share where my journey began. So I'm from Scotland, and this is a picture of me as a brand new graduate registered nurse in Edinburgh. And you can see me there at the Astley Ainsley Hospital, if there happens to be anybody with a Scottish heritage joining us today. And that was a long-term, they called it long-term care unit, where older people lived in a hospital setting, and there was 6 in one room. And it was considered innovative because I chose to work in the best place for caring for the older person in Edinburgh. And gosh, thank goodness things have changed, but there's still a long way to go. Just acknowledging the decade of healthy ageing. Our Healthy Ageing Research Centre has created a strategy that's based on this, the healthy ageing decade. And Marlene, obviously you've been leading the way with combating ageism, so I'm delighted to be able to present today. This is just because I think the slides and the presentation will be shared, just to share with you our Healthy Ageing Research Cluster. We also have a graduate certificate in gerontology, which is multidisciplinary, and our university has age-friendly university status, which we're very proud of, and our memorandum of understanding that was signed with HAT is part of meeting those goals. So what I'm going to be talking about, benevolent ageism. So what's in a word? In nursing, we often hear these terms, or in all healthcare. Somebody's pleasantly confused. I don't know anyone who would feel pleasant when they're confused. There's DAL, cute little old man, sweet old lady. It's really quite distressing for those of us who are gerontological practitioners to hear these terms still living in aged care in the hospital and nursing home setting. And the work that we do is working towards challenging this. And throughout my presentation, you'll see some, okay, thanks, Erin. You want me to go over here?
Oh no, just so they can see your face.
Oh, there we go. Thank you. We've got lots of technical challenges here. Okay, lovely. So, and this gentleman on the left here, he's one of the oldest men in Australia, and Heinz Beans gave him a commemorative jar of Heinz Beans because that's what he has for breakfast every day. And poor old Stephen's seen this photo lots of times, but it's one of my favourites. Do I do it like this? There we go. Okay, thank you. So one of the terms you might have come across is infantilization. Infantilization is when we treat older people like a child. And then the person on the left here is one of the oldest women in Australia, and she's a keen gardener. And Colin knows that I'm an extremely keen gardener. So again, another favourite photo. So infantilization can actually cause psychological distress to an older person. It's treating them like a child, denying them the respect and the responsibility and autonomy that they actually want to enact themselves. It's communicating with them in a way that diminishes the person's competence. And those words that I shared with you on that previous slide are ways that this actually is played out. We might think they're harmless, but actually it's micro effects, has a build-up over time. And imposes unnecessary restrictions on an older person's behaviour because we think we know what's best. And it's making decisions for an older person when they are capable of making the decisions themselves. And in Europe, they have a focus on capacity that's context specific. So, for example, in dementia care, a person can still make many decisions. They still are competent and autonomous in many ways. So capacity is context specific. It doesn't end when a person has dementia, for example, or when a person becomes elderly in another person's eyes. So what's benevolent ageism? It is well-meaning. So in aged care, we do come across it a lot. We see it from adult children, but I wanted to share with you what we see in aged care today. So the staff, the care workers, the registered nurses, the physios and so on, the volunteers will all be well-meaning, kind. They're overprotective and they show compassionate behaviour towards the older person. So they might not actually notice that it's benevolent ageism. It's based on an acceptance of narrow assumptions and stereotypes about the universal vulnerability, incompetence and dependence in older age. And in residential aged care and nursing home care, it is challenging for practitioners because, of course, in nursing homes, we're caring for the most older people who have the most complex health needs, probably very complex social networks because most likely to have dementia, they may be actually receiving end-of-life care. So it's easy to slip into those stereotypical thinking patterns. And as senior leaders, it's our role to actually challenge that. And I'd also like to share this beautiful picture on the side here of Auntie Rosalie Kickett, who is Female Elder of the Year this year. So what are the consequences of this benevolent ageism? It's being overprotective. It's controlling response towards older people. It takes decisions away from older people, and it limits the range of tasks and experiences older people can undertake for themselves because of perceived risk. And this risk is really something that's reducing risk is very much pervasive in a residential aged care, because the practitioners are probably fearful of not providing high quality care, and they're worried about the consequences of a person taking the risk and then being accused of neglect. So it's not as straightforward as you think. But again, as leaders, it's our responsibility to actually provide practitioners with the skills to empower the older people they care for and actually give them the confidence that taking risks is acceptable and okay. And again, I have a beautiful picture here of Uncle Philip Hall, who is Male Elder of the Year. So something that is going to promote and address ageism in Australia is the New Aged Care Act. Now, many of you might have seen some of the, debate about the New Aged Care Act on the news. Any of you who work in aged care, all organisations are doing a lot of promotion around what does the new aged care mean as a service provider? What does it mean for practitioners? And Warrigal, like all other aged care organisations, is promoting an understanding about the change. Now, what's important about the New Aged Care Act is it's based on human rights. It is really fundamentally different from the service provision and the benevolent ageism that underpinned previous ways of providing services. And there's actually a charter of rights now for older people, and you'll be seeing that promoted in various forums, and it will be important to start really understanding, for those of you who are consumers listening today, to actually understand what are your rights and actually thinking about ways in which you can have your rights supported and promoted. So it's about high quality care, it's about access and entry to care, it's about choice and transparency, and it's about a strong workforce. As I said, the workforce needs support to actually empower the older people that they provide services to. And often in aged care, the ageism that older people experience is actually passed on to those who work with older people. So many of you who work in health services for older people will have over the years received so many comments of questioning why you work in aged care. And particularly in nursing, there was a real trend that registered nurses moved into aged care towards the end of their career for a little bit of a quiet life. Now, all of us who work with older people in aged care know how, they would get a shock if they decided to do that because of the highly skilled nursing that's required to support people with dementia, to promote their health and well-being, and now providing end-of-life care, because that's the needs of the older people in residential aged care, and often very complex social networks where the family members are also stressed for a wide range of reasons. So just looking out for your understanding of the New Aged Care Act. Something else that has changed is the way in which we are going to be delivering aged care. So we've got new strengthened standards, and some of you who are up on the news will know that there's been delays with the New Aged Care Act. But in actual fact, aged care providers have been implementing these new aged care standards since July, when they were originally intended to be implemented. And you can see at the centre here, it's the person, and it's about dignity and it's about rights. So the new aged care standards are transforming the way that we are going to be delivering aged care services. But I have to admit that we're not there yet, because some of the rhetoric is that people still think it's about offering choices, and it's more than choices. It's about dignity and respect. It's not about the most recent example that I must admit upset me was when an aged care provider said they're providing person-centred care because they provided a couple with the opportunity to watch a movie together in private. Now, that's not person-centred care. And then, it's much more than choices. It's about having that respect for the older person and promoting dignity. So I loved this photograph. I just thought this is, many an older person will have seen this face, before them, particularly, when they're receiving healthcare services. So We're hoping that, the New Age Care Act, the new standards will actually challenge this benevolent ageism. So I wondered, how can we demonstrate some changes over time? And of course, us academics do like to develop scales and, way to assess things. And these are the 5 top items for a benevolent ageism scale. So we could actually use these surveys to determine whether there is a change over time. So, you ask your staff members perhaps, or volunteers, if they think it's good to speak slowly to old people, because that's how they can, help them understand things. Is it helpful to repeat things? Is it good to contact the family before the older person themselves? Is it, good to avoid accidents? And is the health problems of older patients, are they too complex to be explained to them in detail? So these were the top 5 items that the research has found reflected benevolent ageism. Here we go. And then I wanted to share with you who my superhero is as an older person. Gwenda Darling is on the National Council of Elders for the federal government. And she is just a real powerhouse of challenging stereotypes of what it's like to live with dementia and what it's like to be an older person in, modern Australia. And so I just wanted to conclude with a photo of Gwenda and just pay my respects to Gwenda and all the work that she does and other older people like Gwenda, really challenging ageism and making a difference to other people's ageing life. So thank you.
Thank you, Professor Traynor. That is extraordinarily interesting. If you have questions, I've noted here in meeting chat, I cannot see any questions that have been asked. But if you do have a question related to today's presentation, again, please direct them through secretary@healthyagingpartnerships.au, and we will reach out to the presenters with answers for you. I want to acknowledge the contributions of a variety of people today in making this webinar available. It's only been possible with the valued contribution support of some of our major partners, the University of the Sunshine Coast, EveryAGE Counts and Country to Coast. Thank you to our partners who have supported us there today. Also, thanks to University Sunshine Coast students, Josephine Blackwestead, Vanessa Marchu Ali, and Lorna Jean Gallagher for assistance with scheduling and design, and to Kerry Peck for digital design. Thank you also to Tara McShee for marketing and John Armstrong for promotion and web support. And a special thanks to Erin Stevens and Justine Thomas, who today have done their best with the technology, but we have had a few hassles. It's been a learning experience for us, and I'm sure next time we'll be much more skilled. Finally, thank you for joining the webinar. I hope you have found it informative, stimulating and worthwhile. HAP welcomes community members and partners. Community members can join HAP for free, and we can keep you informed about events and news. We would love to hear from you. Go to our website, Healthy Aging Partnerships. Until we meet again soon, bye for now. Thank you.